if someone has a mental health diagnosis, they're much more likely to have a metabolic disorder, cardiovascular disease, diabetes. For decades, it was the go-to treatment before the anti-epileptic drugs came in. There's a lot of evidence that many of the mental health disorders have mitochondrial dysfunction. And ketones are really there to deal with food scarcity. Kids' brains are more plastic and changeable than adults. An enormous increase in mental health diagnoses after taking these medications. I've seen people gain 80, 100 pounds on antipsychotic medications. And they might get some nutrient deficiencies, and they're losing muscle mass, which is an important part of brain health as well.
Muscle mass or the brain mass can have profound impacts, and hence where there is suicidal ideation. In each episode, we dwell into the realms of wellness, exploring the latest trends, expert advice, and practical tips to help lead you a happy, healthier life. We aim to bring a broader perspective to our American audience on issues that impact your daily life by interviewing guests from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your lifestyle, you're at the right place. Join us as we embark on a journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together let's unlock the secrets to living life to its fullest. Modern mental health and its care is no longer just about managing symptoms. It's about uncovering the deeper biologic and lifestyle factors that shape our well-being. New research reveals how metabolism, nutrition, and lifestyle choices directly impact the brain function, reshaping the way we approach any disease, but especially psychiatric conditions. Rather than relying solely on medication, modern psychiatry is now integrating holistic, science-based strategies that promote long-term healing. This is a shift. It emphasizes mindfulness, metabolic health, and personalized care, offering a more comprehensive path to mental well-being. As these insights continue to grow, they are redefining how we support mental health in a way that is both innovative and deeply human-centered. Welcome to another episode of Khan Clinics. I'm your host, Dr. Amir Khan. Our guest today is Dr. Matthew Bernstein. He is the CEO and one of the leading voices in the emerging field of metabolic psychiatry. Practicing for 25 years, he has got his medical degree from Pennsylvania School of Medicine and residency at the MGH McLean Psychiatry Training Program. Following his training, he remained at McLean Hospital, where he served a number of leading roles. He was part of the schizophrenia bipolar program, substance abuse program, and many others. Beyond his clinical roles, Dr. Bernstein maintains a strong commitment to education. In addition to his practice, specializing in psychopharmacology and psychotherapy, he has developed keen interest in new innovative approaches to mental health. His work emphasizes metabolic psychiatry, integrating nutrition, exercise, and lifestyle interventions. Dr. Bernstein, welcome to the show.
Thank you. I'm glad to be here.
We're going to dip right into it and get to the first question, Dr. Bernstein, if you're ready.
I'm ready.
You often discuss the link between metabolic dysfunction and mental health disorders. Could you explain our audience how chronic inflammation and this mitochondrial dysfunction contribute to conditions such as depression and anxiety?
Absolutely. Yeah. I mean, I think it's bidirectional. So if someone has a mental health diagnosis, they're much more likely to have a metabolic disorder, cardiovascular disease, diabetes, and it goes the other way around. If someone has a cardiovascular, diabetes, or another metabolic disorder, they're much more likely to have a mental health disorder. So we know this from these associations. There are also some studies following kids from a young age, and they can see that the ones who have the most insulin resistance at young ages, like at age 9, are much more likely to go on and develop a psychotic disorder in their 20s. Or the ones who gain the most weight during puberty are much more likely to have a major depressive episode in their 20s. And so we can see that these things are intricately connected. There's lots of mechanisms that have been studied by the neuroscientists, because we've known that a metabolic intervention, such as a ketogenic diet, has been useful and proven to work in a brain disorder, epilepsy. We've known that for over 100 years now. And so we've been studying this. We know the mechanisms by which these metabolic improvements actually improve brain health. And you mentioned some of them: reducing inflammation, improving mitochondrial health. But there's more. There's also the fact that ketones are an alternative source of fuel in the brain. And the brain can often be starving for energy, even though it's bathed in glucose, because of insulin resistance. And almost everyone in America these days is insulin resistant, unfortunately. Sure. And so we know it reduces oxidative stress in the brain by using fat and ketones for fuel rather than glucose. There's many mechanisms elucidated because of that, what we've known about epilepsy. So the neuroscientists have done the work. And I like to say that we have more scientific evidence of how these metabolic interventions work on brain health than I have for any of the other interventions that I use, psychopharmacology and psychotherapy. We just don't have the neuroscience evidence for those interventions in the same way that we do for these metabolic interventions.
Excellent. So, Dr. Bernstein, how do you factor in the metabolic component in your practice? What would you explain to your patients, and how is the discussion led in that direction once you meet your patient and you diagnose a psychiatric illness?
Yeah. Well, most of the people who come to me are already involved in mental health treatment. I'm sort of a tertiary quaternary care kind of doctor at this point, where people have been to their primary care doctor, they've been to psychiatrists, therapists. Eventually they get to me, and they've tried many psychiatric treatments usually by the time they get to me. And the first thing that I explain is how powerful these interventions are, because that is something that most people, including most doctors, most psychiatrists, and I would include myself up until about 5 years ago, just didn't believe and understand, and still don't believe and understand, just how powerful these interventions are for the brain. We're just not used to thinking of a diet or food or exercise having such a profound effect on a serious mental health condition, a serious brain disorder. But the reality is that the scientific evidence is there. And so we have to get over that hurdle first, that this is worthy of our intervention. This is a medical intervention. This is not just have a nice meal and smile and everything's going to be okay. This is a medical intervention, and it's a powerful medical intervention. And so once we can understand that there's something really here worthy of our medical attention, and it can cure these severe mental disorders, brain disorders, then we can start digging into how it works, why it works. Some people are very interested in the science and want to hear about that. Others say, I don't want to hear the science, just tell me what to do. And we can do that.
Brilliant. So you then want to prioritize this discussion, and you customize these approaches for individual patients. You're considering nutrition, exercise, circadian rhythm alignments.
Yes.
What's your thought process at that time when you're evaluating a patient and going through these priorities? How do you plan a customized treatment?
Yeah, great question. So it partly depends on, what are we trying to treat? Is this bipolar disorder? Is it, or is it a severe form of that? Or, Is it something maybe that's doesn't require quite as much? Maybe it's ADHD and some anxiety. How big of the intervention does it need to be? Maybe based on how severe the problem is and how long it's been going on. We look at what the current state of someone's metabolic health is for sure. Lots of lab work, which I wasn't used to doing so much lab work as a psychiatrist. It's not really part of standard psychiatry, but now I'm ordering insulin resistance panels and full fractionation lipid panels and micronutrients and all kinds of things that I didn't used to order. And then part of it has to depend too, and it's a really important part, is how much motivation does this person have to make all of these changes? Are they someone who's going to need to do it gradually and one thing at a time? And if that's the case, then we want to do something in the beginning that's going to get them feeling better immediately. So we want to get a win right off the bat, get people convinced that this is really important, this is helpful, and I want to keep going. Or is it someone who says, just tell me everything that I need to do, and I want to do it all? And I do have some people like that where we can just sort of dive right in with all of these changes, which is super exciting because those people often feel significantly better in just a few weeks, which is incredible. Some of these people have been suffering for many years. So lots of factors go into it. And of course, I'm trying to think out loud as much as possible. I think,
Sure.
That's true in medicine in general these days, that we want to, as physicians, give everyone options, give them the medical knowledge that we have. And I'm lucky enough to practice in a way where I have a lot of time to spend with people and really talk them through what the options are and what my thought process is, and we can sort of make decisions together that way.
Excellent. So that explains you're going to prioritize, you're going to identify the disease, you look at how motivated someone is,
Right.
and then you start targeting which parts am I going to go to, how am I going to incorporate the exercise, is it going to work, how am I going to incorporate diet, and look at a holistic approach, and then start targeting it. We're going to go to the next question that you use in your practice, and that is benefits of diets. And we're going to talk about a little bit about the ketogenic diet. We want to know, how does it help the mental and brain health?
Yes.
What's your views on it? And then we'll talk about how do you incorporate that into your practice?
So the ketogenic diet, as I mentioned before, is an evidence-based medical intervention. It was started in 1921 at the Mayo Clinic to treat kids with epilepsy. And there are now more than 12 randomized controlled trials showing that it works in epilepsy in both kids and adults. So, and it's often the go-to treatment when medications don't work. For decades, it was the go-to treatment before the anti-epileptic drugs came in. Generally people gravitate towards medications rather than diets for many reasons, because it's easier. We just take a pill. We don't have to change every single thing on the plate and think about it all the time. I'm not sure that that's so wise in the long run, but that's generally sort of how people think about things. But what they find is that especially when kids, sometimes they're on 2 or 3 anti-epileptic medications and they can't get control of the seizures, they'll switch them to a ketogenic diet, and it actually will control the seizures. They can sometimes take them off the anti-epileptic drugs. And then amazingly with kids, and this is not true of very many brain disorders, they can do the intervention for a few years, and many times they can actually come off of the ketogenic diet and still retain the seizure control.
Interesting. Very interesting.
So we can't promise that in mental health. We haven't studied it enough, but in the epilepsy experience, that actually does happen. And, of course, it's kids versus adults. That's a big difference as well. Kids' brains are more plastic and changeable than adults. So, some of the mechanisms of how ketogenic diets work on the brain, we've already talked about. This alternative source of fuel that bypasses the brain insulin resistance, the improvement in mitochondrial health. The number of mitochondria and the functioning of the mitochondria is incredibly important in the brain, because we know mitochondria are the energy factories in the cells, but they do a lot more than that. They're involved in the release of neurotransmitters from the neurons. They're involved in the first step of the synthesis of hormones. Mitochondria actually send signals to the nucleus to tell the nucleus which DNA to express and which not. And so we now know that mitochondria are involved in all these different aspects of cellular health. And there's a lot of evidence that many of the mental health disorders have mitochondrial dysfunction. So we think that that's a really key mechanism. And I've named a couple of more. You named one, which was reducing neuroinflammation, which is a big part of all mental health disorders, reducing oxidative stress, improving the microbiome, gut-brain axis, increasing brain-derived neurotropic factor, which is sort of like miracle grow for these neurons, telling these neurons to go and make more connections with other neurons. All of these mechanisms have been shown to be part of how ketogenic diets help brain health. And I think the science of how it helps with mental health disorders is still really in its infancy, but we're learning more and more every month. There are papers coming out about ketogenic diets and mental health disorders, at a rapid pace at this point. Clinical trials are happening right now in mental health disorders. There's a number of them around the world, and so those will be published in the next few years as well, and we'll have to see just how effective they are in that kind of trial setting.
Excellent. I think it's a fascinating topic, evolving. We're seeing, and in our program, we have seen people come in and talk about ketosis, how it's affecting Alzheimer's. And one of the areas that's been studied a lot has been the Alzheimer's and the dementia patients. And you just pointed out how the mitochondrial, how the insulin resistance, how for some reason the glucose is not as effective, and how ketosis and ketones getting there, and MCT chains and others have been able. So thank you for explaining that, and I'm glad, and find it very fascinating that it is coming into psychiatric pathology as well, whether it's anxiety, depression, you name it, and epilepsy, other conditions as well. One of the areas that's been discussed in relation to that has been ketosis and how we can stimulate or result in a surge in that. And that's when intermittent fasting comes in.
Yeah.
Would you like to explain to our audience here the role of intermittent fasting? How could it influence the brain function and in mood regulation, especially now that psychiatric patients play a big factor in it?
Yes, absolutely. So, fasting has a very, very long history. In fact, we evolved in states of, food scarcity, our evolutionary lineage. There was always food scarcity, right? Absolutely. And so our physiology, our biology is designed to deal with food scarcity. And in fact, I think a lot of people argue that it's designed that ketones are really there to deal with food scarcity and allow our brains to function when there's not as much food around. Think about, 500,000 years ago or 1 million years ago, proto-humans, if they didn't have food for a day or two, if they were getting irritable and low energy and, as we say, hangry, they weren't going to survive. And that's not what happened. What happened is their bodies went into ketosis very easily, started using their fat storage as fuel, and created these ketones, which are so good for the brain and allow the people to think and to function and to go out and acquire food. And that's how we survived. Fast forward to the time of the ancient Greeks with Hippocrates, they knew that they could cure epileptic seizures with fasting, and they used to fast people who were having uncontrolled seizures. The physicians used to do that in ancient Greece, and then eventually then at the Mayo Clinic. And essentially, fasting does have a role, I think, in the modern metabolic psychiatry space. Some people, can really jumpstart their metabolism, jumpstart that process of using fat, reverse that insulin resistance with a fasting schedule. So that might look like, not eating for, let's say, 16 hours of the 24-hour cycle and only eating during an 8-hour window. That's a version of fasting called time-restricted eating. Sure. And that's been shown to be, quite effective for things like reversing insulin resistance and weight loss. I've used it in my practice quite a bit in the early stages when people want to just get going and jumpstart things. What we can do sometimes as well is that in the morning, after someone, let's say, stops eating at 8 p.m., they're not going to eat again until noon the next day. they wake up in the morning, I'll ask them to try some of this stuff called MCT oil, or medium chain triglyceride oil, which is
Interesting.
a type of coconut oil. It's a refined coconut oil essentially. Those medium chain triglycerides are small. They're not long chain fatty acids. They're sort of medium chain fatty acids, and they're easily turned into ketones in the liver. And so in the morning, if someone hasn't eaten and their insulin is on the low side because they haven't eaten, they take in that MCT oil and the liver will convert almost all of it into ketones immediately. And so they'll get a boost of ketones even without doing a ketogenic diet. And that will then let them feel that boost of alternative energy in their brain. And many people will come back after I ask them to do this, and they'll come back to the next appointment and just say, wow, that was amazing how I felt when I had that, those MCT oil in the morning, and I just didn't get hungry. I felt energy. I felt great. My mood was uplifted. I wasn't anxious. And, that's one of these, win kind of early interventions where people then realize that, I have something to offer here. This is not just, we're going to change our food and smile. This is a real serious intervention for their brain.
Absolutely happening.
Yeah.
We had earlier one of the doctors here who Dr. Newport, and she and Dr. D'Agostino talk a lot about the MCT,
Yeah.
How she saw benefits and how they've been using and advising patients. So I'm fascinated that you're already using this as a tool to help you practice. Is there any specific conditions you've seen this affect more than the others? Follow-up question would be, do you advise them how much to take and on a regular basis just incorporate there in their lifestyle? How do you go about doing that?
Yeah, that's an excellent question. I wish I knew in advance, who are the people who are going to really respond well to the fasting and MCT oil intervention. Some people respond more than others, and I think it has to do with which people have more central or cerebral insulin resistance as the mechanism. If that's the case, then we're kind of immediately bypassing a blockage that they have in terms of creating energy in their brain by giving the MCT and creating ketones. And I think, especially with people who are getting elderly, who have mild cognitive impairment, it's almost always the case that they have some cerebral insulin resistance.
Excellent.
And so for those folks, you're almost always going to see something. With younger patients that I see who, have a psychiatric condition, whether they have depression or bipolar, I think sometimes we see this as well. And sometimes we see it even in people who there's no sign of insulin resistance on their blood work. They may still have brain insulin resistance even without insulin resistance measurable in their blood. So that's another fascinating thing that we're finding, is that different organs become insulin resistant at different rates, and that it may be that mental health conditions, confer a higher rate of brain insulin resistance even without we're seeing it in the blood. So what I ask people to do often is, sometimes they're having coffee or tea anyway, and I'll ask them to mix some of this MCT into their coffee or tea. They can put a little bit of either butter or heavy cream in there just to emulsify the two together, because, water and oil don't mix so well, and make a delicious drink out of it. It can be, usually the standard dose for MCT oil is a tablespoon. Although I wouldn't have people start with that. Usually we start with just maybe a teaspoon and work up to a tablespoon as long as their stomach tolerates it. Because some people, they start with a tablespoon and they can get an upset stomach, which we don't want to do. And then some people might even take up to 2 tablespoons at a time and get even higher boost of ketones that way.
And thank you for that advice. Make it like a little coffee drink and
Yeah.
mix it up. And I'm going to start doing that. Mix it and use it.
Yeah, it's very helpful, I think, in this part of the psychiatry to have a little culinary interest and skills, because, when you're trying to get people to eat a different way, we want to make them enjoy also what they're eating. And we don't want it to be like they're taking some awful medicine. We want it to be an enjoyable experience.
Absolutely. Absolutely makes sense. And thank you for that tip. Dr. Bernstein, you've highlighted the challenges of weight gain now, and how antipsychotic medications can be affected. There's a metabolic intervention that can help counter this effect. What practical strategies would you recommend our audience to help maintain a healthy weight and then at the same token continue using their psychiatric treatments.
Right. Yeah, that's a great point. A lot of the medications that I use all the time, confer metabolic disturbance and weight gain. You mentioned the antipsychotics, but it's also true of mood stabilizing medications. It's also true of most of the antidepressants as well, although not quite as bad as the antipsychotics, which can cause sometimes tremendous amounts of weight gain. I've seen
Sure.
people gain 80, 100 pounds on antipsychotic
Absolutely.
medications. And,
Yeah.
of course, sometimes people will need to stay on these medications, but we need interventions that can help people get out of the medical comorbidities that are going to come with gaining that much weight, and just the drag that it creates on people's ability to live their life, to function out there in the world. So, so some of these strategies we've already talked about are excellent for reversing, weight gain. Ketogenic diets, intermittent fasting. I want to see people exercising, and I usually recommend a blend of some aerobic and resistance training for people. We have to sometimes start slow if someone's been sedentary for a long time, but eventually we want to get them, in the gym if possible. And so this can help really reverse some of these awful side effects of the medications. And then, of course, part of what we can sometimes see is that not only are we reversing the side effects, we can get to the point where we need less of that psychiatric medication in the first place, because their metabolic health is improving, because we're giving them this, improvement to their brain functioning. Sometimes we can reduce the dose of the medications. And in some cases, people have been able to come off of psychiatric medications, although that really needs to be done in concert with their physician. I'm not here recommending people taper themselves off of their medication.
Sure. Thank you for explaining that. But the next question is going to be one of my favorite questions.
Yeah.
This is about GLP-1 receptor agonists.
Yes.
Ozempic, and Tripazide is in the market. It's hot.
Yeah.
It's really helping, truly so, hundreds and thousands of people. And yet FDA has put in a quite strong black box label about suicidal ideation. I want to know your thoughts on this, even though there is some literature and some suggestions of how this could really have helped psychiatric patients. How are you navigating these waters right now as obviously seeing your patients, and still the research is coming through?
We really don't have definitive answers yet about how these medications affect mental health. There's signals going in both directions. In fact, we've seen some signals in the literature about improving depression, improving addictions. There was a big paper that just came out a few weeks ago that they studied huge numbers of people in a database, and they saw an enormous increase in mental health diagnoses after taking these medications. They looked at a big cohort of people with obesity, some of whom were prescribed the GLP-1 drugs and some were not. And the people who were just prescribed those drugs had huge increases in new diagnoses of things like depression and anxiety and bipolar. So how do we make sense of this? So the way I make sense of it is that I think that there is a big risk of these medications if they're not done the right way. Meaning, if someone is not given enough support for dietary advice and exercise, and they're just relying on just the drug and not changing their lifestyle, I think that people can run into great risks metabolically and for their mental health. They can get nutrient deficiencies. Often people will use these drugs as a way to just eat less, but they're eating the same ultra processed food without a lot of nutrient content. And so they just reduce their calories. And so their metabolic health, actually, even though they're losing weight, their metabolic health isn't necessarily getting better. And they might get some nutrient deficiencies, and they're losing muscle mass, which is an important part of brain health as well. However, I've seen them also just be tremendously helpful for many of my patients. And the key, though, is that these are great tools to be able to make lifestyle changes. The lifestyle changes are what provides health. The GLP-1 drug is a tool to create lifestyle change, and the lifestyle change is where we get health. So that if people have that framework in mind, they can be really helpful medications, I think. But I like to see people use them for a period of time to make the lifestyle changes. And then over time, I want the lifestyle changes to take over. And then we can taper off of those drugs eventually. That's the goal in my view.
Man, to me, that's a really a fascinating, eye-opening point. And as the trend is increasing of using Ozempic and other medications that are there in sleep, there's Zepbound has a profound effect. But we have not studied or not studying enough where you've said the macronutrients and especially which scares me is the muscle mass or the brain mass,
Yeah.
as a matter of fact, can have profound impacts and hence where there is suicidal ideation. So obviously, there is a tremendous need to give to your patients, hey, you got to take this, this, and this, and if you don't take this can have a negative effect on you.
That's right.
So and hence you're describing about the suicidal ideation, but before that there must be more of a path. And I was just wondering, well, how could they have more anxiety and depression and more psychiatric illness when they're losing weight? They should be happy. And you just nailed it and say, well, no, Amir, it's not just that. It's just it's the deficiency that is causing, that's not being addressed. And we don't adjust our lifestyles to a medication that has profound metabolic effects. I mean, this is yes, it's a game-changing medication, but
Yeah.
like how you pointed out, this opens up the field of metabolic psychiatry, basically. So you must be facing some challenges in this. How do you see, first of all, the field heading in the next few years and perhaps even more?
Yeah, I mean, I think what I'm hoping that this becomes much more mainstream. I mean, I think right now, just to be honest, that people, psychiatrists like me, are pretty rare who are focusing on these types of metabolic interventions. It's very new, and there's not a lot of randomized controlled trial data to convince people yet that this is the direction we need to go. But I think I feel like it is the future in many ways. That this is going to help save the field of psychiatry in many ways, because what we've been doing so far is we're over relying on the medication. We're over relying on that the medication is going to solve everything, and we know from the clinical trials, and any honest psychiatrist will tell you that a medication alone almost never solves a severe psychiatric problem. It has to be combined with all kinds of other things, but yet our system sort of relies just on the medication. And so similarly, I think we need other important biological interventions. There are some promising things happening in other parts of psychiatry as well, with some psychedelic medicine, with some brain stimulation. I think TMS is becoming interesting in terms of how people are able to use that. But I really feel as though the foundation is metabolic health and creating brain health. And I hope and I foresee that my colleagues will start to see this more the same way as I do over time.
Yeah, fascinating. We're opening a door for something that has profound effect, but yet from it, there's gonna be more things that's gonna stem from it. No, you're absolutely spot on, and I'm looking forward to what's gonna be out there. Dr. Bernstein, we're running out of time. We would love to hear your final comments about a message that you want to give out to the audience, specifically in this field, and just in generally psychiatry. Whenever psychiatrist or a psychiatry, the name comes about, all of us get very scared still, and mental health, as big as it's become, and as important as it's become. What sort of message would you like to give our audience? And
yeah, I appreciate that. And I appreciate that, for some people, what we're talking about can feel uncomfortable. There's still stigma out there about these conditions. And I think, having done this for a long time, and I try to, still be just a regular guy. But what I can say is that, these are just medical disorders like any other, and we should treat them as such. And we have interventions. We have tools. But we also need to keep really open minds that the tools we have are good, but we can do better, and we need to do better, and we need to empower patients. I think in my field, we often give people a really awful choice. Either you can have mental health and not have any physical health, or you can have your physical health, but your mental health is not going to be very good. And no one should have to make that choice. No one should ever have to choose between their physical health and their mental health. They should be able to have both. And I think we've figured out an intervention here that really works on both ends, and that is super exciting, and I think very hopeful. So I want to leave people with that message of hope that this really can help.
Absolutely. Message of hope and message of inspiration. And you know what, Dr. Bernstein, we're really grateful that there are people out there like you who are thinking along these lines and, trying to address these issues and answer the questions. We're pretty tough, especially when there's very little data or limited data out there. And so we want to just pass on that message to you. We want to say thank you very much for sharing your thoughts. We really appreciate it. I personally enjoyed the show a lot. So thank you for being on our show, Dr. Bernstein.
Thanks for having me. I really enjoyed being here.
And to our amazing audience, thank you for tuning in for another episode of Khan Clinics. If you've enjoyed the show, please share it with your friends. Give it a thumbs up, hit the subscribe button, and feel to drop your comments. We love hearing from you guys. Also, don't forget to spread the word, tell your friends about us. Have a good evening and stay blessed.